and modify. Stop, drop it low, but pick it up carefully. Work them glutes like you in physical therapy.
So welcome back to my channel, guys. Today in this lecture we will discuss about the anatomy of the gastrointestinal tract. So the gastrointestinal tract includes the digestive system which runs from mouth to the anus. It includes esophagus, stomach, small intestine, large intestine, and accessory organs. The inferior end of the esophagus is included here because it is its general relation is related to the abdominal cavity. This is not the entirely esophagus. Okay, so esophagus is basically a muscular collapsible tube about 10 inches in length that join the pharynx or to the stomach. It enters into the abdomen by the right crus of the diaphragm after a course of 0.5 inches at T10. It enters on stomach to its right side. It lies to the posterior mediastinum, crosses the thoracic duct at T5 from right to left. So the narrow point of the esophagus which restricts the food to return to the mouth is actually the cricopharyngeus muscle, bifurcation of the trachea, lower esophageal sphincter. Okay, so now we will discuss the part of the esophagus. There are three parts of esophagus: the cervical, thoracic, and abdominal. The cervical part starts from the pharynx to the substernal notch. The thoracic start from substernal to the diaphragmatic hiatus, and the abdominal part start from the hiatus to the cardiac orifice. Okay, so relation of the esophagus. Anteriorly, the esophagus contains aorta, the anterior left lobe of the liver, trachea, aortic arch, esophageal plexus, mediastinum, pulmonary artery, pulmonary right bronchus, and diaphragm. While the posterior relation of the esophagus is the posterior surface of the left lobe of the liver, vertebrae, intercostal arteries, esophagus vein, the left crus of the diaphragm, while laterally it contains the left and right vagus nerve, the left descending aorta, thoracic ducts, lungs, and left hemizygus vein. As you can see here, this is the cervical part, this is the thoracic part, and this is the abdominal part. So here in front you can see abdominal aorta, the vessels, and posteriorly you can see here the vertebrae, and you will also found the trachea interiorly over here. So histology of the esophagus, it contains from outer layer to inner layer above the abdominal part. So it have the mucosa which is contained a stratified squamous epithelial cell, the submucosa which contain mucus glands, and muscular layer which contain external longitudinal muscles. And it is also having adventitia which drain into above cervical, is deep cervical, and thoracic is into the mediastinal nodes, lymph nodes. Unlike others, the esophagus does not have a serosal layer. Between the abdominal part, mucosa contain the squamous to simple columnar epithelium, submucosa contain mucus gland, and muscular layer contain internal smooth muscles. Involuntary external are the longitudinal muscle which each drain into the gastric and para aortic nodes. Okay, this part is the above the abdominal part, and this is the below the abdominal part, the last features that I discuss. So blood supply of the cervical part is from inferior thyroid artery, the thoracic part is from thoracic artery, and the abdominal part is from the left gastric artery. Okay, the venous supply is from the hemizygous vein, esophageal vein, left gastric vein, all together drain into the portal vein. Okay, the splenic and the superior mesenteric, inferior mesenteric also drain into the portal vein. Upper two part drain into the mediastinal lymph node, lymphatic supply. The lower to abdominal part drain into the gastric and para aortic nodes. So its nerve supply is from the anterior and posterior gastric nerve, which is the subdivision of the vagus nerve, and sympathetic branch of the thoracic part of the sympathetic trunk. So this is the entire blood supply of the esophagus. As you can see here, cervical part arterial supply is from the inferior thyroid artery, thoracic artery, and the abdominal part is from the left epigastric artery. The venous supply is from the cervical part having deep cervical vein, thoracic part is into esophageal vein, and the abdominal part is from the left epigastric and hemiazygous vein. So the lymphatic drainage is into the cervical part having deep cervical lymph, thoracic part posterior mediastinal lymph, and abdominal part is para-aortic and the left epigastric lymph. The nerve supply, parasympathetic part supply is for the cervical region is for the recurrent laryngeal nerve, thoracic part having the left and right epigastric nerve, or branch of the vagus nerve, and sympathetic having innervation from cervical part, the cervical nerves, and thoracic and abdominal nerves from T1 to T4. So function of the esophagus is to conduct the food from pharynx to stomach. The wave-like construction of a muscular coat is called as peristalsis, which is actually a propulsion of food onward. Okay, the gastroesophageal sphincter. Basically, there is no anatomic sphincter exists in the lower end of the esophagus. However, circular layer of smooth muscle in this region serve as a physiologic sphincter. As the food descends through the esophagus, relaxation of the muscles occur at the lower end, occurs ahead of the peristaltic wave, so that the food enters into the stomach. The tonic contraction of the sphincter prevents the food from regurgitation to the esophagus. The closure of the sphincter is under the vagal control, and this closure can be augmented by the hormones that include the gastrin and reduce in response to the secretin, cholecystokinin, and glucagon.
If it hurts to modify, stop, drop it low, but pick it up carefully. Work them glutes like you in physical therapy.